My name is Viju Jacob.
Dr. Alejandra Morales.
Jennifer Genuardi, and I'm an internist and pediatrician.
Director of Behavioral Health Services.
I'm one of the pediatricians here at Urban Health Plan. Our focus is always that direct provider-patient relationship.
When I leave work, patients wave to me on the street. They tell me how their children are doing. They ask about my family.
We look at our patients in a holistic way. Everyone is working to serve the patients.
And that is the core that builds all of the other things that we do.
I think people, when they walk into a place that looks nice, looks welcoming, just start feeling better.
Respect, affection, quality, caring. If you demonstrate that and the message gets through to the patient, he's your patient for life. When I opened the San Juan Health Center, the Bronx was going downhill. Initially, it was a group practice, but eventually it became the nonprofit, the community advocacy. All of the things that I dreamed about were put into one package, the Urban Health Plan.
We hired from the community as we served the community, and we've been very conscious about being community-based, family-oriented, so that people come here and they feel like they belong here. When we built our first building, someone asked me why I was building such a beautiful building. And I always believe that everyone deserves a proper place to be treated. We don't cut corners on anything that we do for our community.
This institution has more to do than just providing preventive health care for our community. It's an economic development engine. It's an educational institution.
It's been a vision. It's been not giving up on a neighborhood. It's not giving up on a community.
Everybody wants good health care, but to have somebody go above and beyond, it's priceless.
When we start a project, we're goal-oriented, bottom-line oriented. And we set our goals, and the only thing that we don't know is when it's going to happen, but it's going to happen.
Community health centers have to grow in order to meet the demand of healthcare reform, where primary care is the focus. And since 2001 to now, we've had tremendous growth.
I want to welcome you to our newest and most exciting facility, the Simpson Pavilion.
We're right now in the process of continuing to open more sites and more schools, and it just seems that opportunity kind of comes our way.
This is our GYN waiting area. We actually expanded this a little bit. There was actually another exam room outside the space.
And then we have our dental equipment. That's a panoramic, so it takes a picture of the entire mouth.
This actually machine can see behind the eye, capture an image, and go straight into our electronic health records.
When I first came here, we had 15 staff members. Today we have 727.
I started here when we were San Juan Health Center in 1972. And I did a little bit of everything. Medical assistant, lab technician. Now I'm the director of pediatrics. And when I see my patients bringing their children to me, it's awesome.
Just lay down a little bit.
One of our commitments is to assure that our patients have comprehensive services. So we provide 18 different subspecialties here.
And looks like it's going to start over there.
We have a whole spectrum of diagnostic testing and all kinds of ways of reaching out to patients. Health education, nutrition, social services. We have Zumba classes, Tai Chi, kickboxing, dancercise. We have a demonstration kitchen staffed by an in-house chef who happens to be a registered dietitian. And the goal is to have our community residents and our patients actually learn how to cook healthier foods. We now are setting up a dedicated geriatric center. Yeah! And we developed an adolescent health and wellness center that serves only teens. That's really responsive to the needs of that age group.
We have kids who are now at the University of Pennsylvania. And here we go. But I get really emotional because I think at the end of the day, it's not only about healthcare, it's really about providing kids with so much more that really improves their overall quality of life.
Poetry reading. It sure seems like your average English class, but the experience for students at the Dr. Richard Escuado Health and Science Charter School goes well beyond reading, writing, and arithmetic.
In the year 2020, 2030, we're going to have a tremendous lack of healthcare providers, and we intended to put in place homegrown healthcare providers. We are developing a new generation of doctors.
If anything hurts you, let me know, okay?
My mission has been to improve the disparities of the community that we live in. Health disparities, economic disparities, educational disparities, and happiness disparities.
Sometimes we help the doctor help take care of my mom.
This is gonna be the clinic that I'm gonna be attending with my baby, no matter what.
It's like family, so you know you're safe, you're comfortable with the people here.
When I look into the future, what I see is a changing, evolving healthcare arena. And we are positioned well to play in that arena. And we expect Urban Health Plan to thrive just like it has for the past 40 years.
And there's more to come. The best is yet to come.